So poverty and poor health are inextricably linked, and poverty, obesity, chronic disease are connected. Obesity helps cause diabetes, which helps cause, kidney issues. And we know that the coronavirus attacks kidneys. Obesity is also linked to heart disease. Heart disease is also linked to poverty. Stress is linked to heart disease, and certainly being chronically low income. And many of our individuals in New Orleans are impacted not only by being low income, but by cycles of violence and trauma from early childhood. So all of this leads to the perfect conditions for chronic disease. And what we're learning about this virus is that it is opportunistic, and that it is very deadly to people who have multiple organ disease.
We have both of our traditional ICUs are full or almost full of individuals who are either COVID-19 positive or under investigation. We've had to open up a third ICU in our facility that up until this was shelled out but not active. It's now manned and has patients in that unit. So basically, we have stepped up the staffing, the nurses have stepped up, administration has stepped up, the schools of medicine, the hospital, everyone has really pitched in to provide the doctors, the nurses, the therapists, everybody that we needed to be able to deal with a greater critically ill cohort than we traditionally have the ability to care for. I think it's a very good question whether or not just having that phenotype, those conditions, simply render you less able to control the viral replication. Whether something about the immune response in those individuals that is either insufficient or maybe even perhaps excessive, causing too much inflammation. And we think that a lot of the organ dysfunction we see in this COVID syndrome is the result of excessive systemic inflammation. We know that folks that are obese a lot of times have markers in their blood of excessive systemic inflammation.